Meet Weepy Waffle. She's a happy-go-lucky individual, but lately she hasn't been feeling normal. For the past 2 weeks, she has experienced a loss of appetite, persistent sadness, fatigue, and sleep disorders. These problems have gotten so bad that Weepy had trouble focusing on her job, her studies, and her own personal health. She went to see her doctor and was diagnosed with depression.
Well, what are the symptoms of depression?
Hopelessness, depression, sad feeling, increased crying spells, poor concentration, inability to focus, the same thing, no motivation, no energy, increased sleep or decreased sleep, sometimes agitation. Basically these. And if the depression sometimes gets very serious, people can get psychotic. They start hearing voices, seeing things, but those are very extreme depression. Okay. And one of the symptoms of depression, I forgot to say, having suicidal thoughts. And the criteria they have set up is, if a person have like out of 10 symptoms that we have to memorize, I can tell you, they have 7 or 2 weeks. It is designated as major depression. Causes of depression, again, depression we can divide them as exogenous depression and endogenous depression. Exogenous is any stress in life. Failure, divorce, anything, any stress can cause depression. Endogenous, this is exogenous depression, and endogenous depression is where the serotonin level goes down. And now, it is not only one neurotransmitter that are causing depression, but that plays a major role.
Let's look at what normally happens in Weepy's brain. In the nervous system, a signal between cells is transmitted at a synapse. A synapse consists of 2 neurons coming together, a presynaptic neuron and a postsynaptic neuron. The space between the 2 neurons is known as a synaptic cleft. In synapses of neurons from the medulla, the serotonin is contained in vesicles in the presynaptic neuron. When an action potential travels down this neuron, the vesicle fuses with the membrane via calcium-mediated exocytosis, and serotonin is secreted into the synapse. Here, 3 things occur. 1. The serotonin binds to receptors on the postsynaptic neuron, which propagates the signal. 2. The serotonin will not bind to receptors and simply diffuses out of the synapse or is degraded by enzymes. Or lastly, 3. Serotonin is taken back up via serotonin transporters on the presynaptic neuron. In the reuptake mechanism, the serotonin transporter, or SERT, acts as a portal to allow serotonin to re-enter the presynaptic neuron with the help of sodium and potassium ions. As sodium and serotonin bind to the receptor, SERT changes conformation, or flips, and releases serotonin and sodium into the presynaptic neuron, while potassium is secreted into the synaptic cleft.
So what does serotonin have to do with depression?
The serotonin gets depleted, and people get the symptoms of depression, provided there is no situational change. They have everything the way it was. They are not supposed to feel hopeless, but they start feeling hopeless.
So basically, in depressed patients, the concentration of serotonin in the synapse is decreased. Because there are fewer molecules of serotonin in the cleft, it is less likely to bind to receptors on the postsynaptic neuron to induce an action potential. However, there is still serotonin diffusion out of the synapse and degradation by enzymes, as well as reuptake in the presynaptic neuron via SERT. This causes a further decrease in serotonin concentration. One way to increase the concentration of serotonin levels in the cleft is to block reuptake. This is where Selective Serotonin Reuptake Inhibitors, or SSRIs, come into play. The SSRIs bind with SERT and inhibit its ability to flip, which prevents the movement of serotonin back into the presynaptic neuron. Because less serotonin is taken back into the presynaptic cell, it is free to diffuse across the cleft and bind to the postsynaptic neuron, thereby propagating a stronger signal.
So how effective are SSRIs in treating depression?
They're very effective, but I would say that will I only put somebody in SSRI? No, I would always add psychotherapy. If it is a person who I think will benefit from psychotherapy, 4 to 6 weeks is the time it takes for the serotonins to come up. So until you have given a patient 6 weeks of good time with the optimum dose.
And true enough, after 6 weeks of SSRI treatment, weepy serotonin levels were back to normal and she returned to true form.